Hi folks, Dr. Ed Beyer. Today we're discussing the underlying causes to female hormone imbalances. I practice functional medicine in Tinley Park, Illinois. I've been doing it for 30 years, and I have had hundreds of females come to me over the years with complaints of PMS, migraine headaches, anxiety, depression, brain fog, mood swings, weight gain, fatigue, acne, polycystic ovarian syndrome, endometriosis, infertility, and the majority of them go to their OBGYN, and what do? They put them on synthetic hormones, birth control. And that really does not address the underlying causes. Today, I'm going to be discussing one of them, which is gut function. And this is an extremely common problem that I see when females come to me for female hormone imbalances. So let me explain how the gastrointestinal, the gut function, impacts hormones and how they work in the female body. Okay? Proper gut function and hormone balance. Now, we have living in us or on us over 100 trillion bacteria. These are called which means good for us, biotics, probiotics. These are very beneficial for us, and 80% of them are in our digestive tract. The other 20% are on our skin, in our upper respiratory tract and sinus membranes, and lower genital urinary tract. This is a whole ecosystem that lives on us and in us, but 80% are in our gut. And when one area goes bad, they can communicate to the other area, right? So that's very important and doesn't really have anything to do with what we're going to talk about today, but I just like to talk about that. So this is called the gut microbiota, or the gut microbiome. It's a little world living on us. They're good for us and we're good for them, and they do things for us. So this is known as probiotic, beneficial flora, gut flora. There's a lot of different names for it. I like to call it the gut microbiome. When bad bacteria, when certain bacteria overgrow in the gut microbiome, that is not a good situation. This is known as dysbiosis. Dys meaning bad, biosis meaning ecosystem, right? So we can measure this on a stool test. So the gut microbiome needs to be balanced. One of the best ways to keep it balanced is by eating a diversified, key word, diversification of plants, vegetables. Is the best way to keep this gut microbiome healthy. But when they overgrow, that becomes a problem. So some of the symptoms of overgrowth of bacteria in the gut are bloating, burping, all these abdominal symptoms, okay? Gas, constipation, diarrhea, acid reflux, GERD, malabsorption, which causes a whole bunch of problems, bad breath, swollen tonsils, undigested food, fatigue, nausea, vomiting, foul smelling stools, and all of that. All right. This dysbiosis leads to infections because now the microbiome isn't there, it's not working like it should, and certain infections can easily take root in our gut, and that causes more digestive symptoms, but it leads to inflammation, not just in the gut, but throughout the body. And when we start to become inflamed in the body, the area of the brain, the hypothalamus and pituitary gland, that is the area that controls our hormones, especially in the female, luteinizing hormone and follicle stimulating hormone that controls the ebb and flow of estrogen and progesterones in the female cycle, need that area of the brain to be working very well. When the body's inflamed due to poor gut function, that area of the brain doesn't work very well, and it's a major contributor to female hormone imbalances. It also leads to weight gain and aches and pains throughout the body. Dysbiosis, or a poor gut microbiome, also breaks down the gut barrier. And now we have microscopic holes in the gut barrier, creating a condition known as leaky gut syndrome. Leaky gut syndrome allows larger than normal molecules of food to make their way into the circulation, which causes inflammation, which damages or causes a dysfunctional neuroendocrine axis. The pituitary and hypothalamus don't do very well. Autoimmune disease causes inflammation, which also decreases the ability of the brain to control hormone fluctuations. And food sensitivities also will lead to that. So it's something that we have to look at. Also, when the gut microbiome is not good, when we have dysbiosis, we have an inability to clear those endocrine disruptors that we talked about earlier in prior videos, and that leads to hormone dysregulation. And also we have an inability to biotransform in the liver the hormones that we're trying to remove out of the body after we're done using them. So we get reabsorption of hormones back into the system, creating hormone dysregulation. And traditional medicine doesn't even look at this stuff. This is huge. I can't even remember a female hormone imbalance case or patient that did not have some dysregulation in the gut. And so it really needs to be looked at if you're serious about getting to the underlying causes. Now, what would cause dysregulation in the gut? This is another 1 to 2 hour topic, but I'm going to condense it. Poor stomach acidity, a condition called hypochlorhydria, inflammatory diet, food sensitivities, poor brain-gut communication, which is done via the vagus nerve from the medulla, antibiotic usage, C-section babies. Now, when we're born, we have very little microbes down in our gut, almost hardly any. And the first mouthful of bacteria that we get is from mom's vaginal canal. And then they take root in our gut, and that's why later, in ensuing months, we're able to eat solid foods. But what if we're born C-section? We don't have that. And I think it's 31% of all babies born now are C-section. When we're breastfed, we get this substance called colostrum from mother's milk that allows the growth of the bacteria, the good microbiome in the gut. Well, what if we're not breastfed? Okay? And these babies tend to get sick. They develop middle ear infections. They go to the doctor, pediatrician. They get put on antibiotics, which then decimates the good bacteria, and they get into this downward cycle till they end up in my clinic at the age of 22 or 32 or whatever with all these hormone imbalances, and they're on the pill. It's maddening to me, and it's the reason why I make these videos, so people really learn this stuff and you have knowledge and you have choices. Or taking the wrong probiotic. We seem to think probiotics, woohoo, they're good for everybody, right? No, you could be messing yourself up with the wrong probiotic. And how about if we're taking some of these medications like Nexium, Prilosec, omeprazole, pantoprazole, all these proton pump inhibitors, Tums, these all really alter the pH in the system, and it'll destroy our good friendly flora. To restore gut function, proper testing is crucial. One of the most important tests we do is stool testing, food sensitivity testing, and testing for leaky gut. And once we identify it, then we can fix it. And this is a major contributor to female hormone imbalances. I'm Dr. Byer. I hope that helps. Have a great day.